So clinical encounters are always different, of course, and they can have many different phases. We always start by reading the medical record, and this can be like a 30-second scan or a 20-minute study, depending on the circumstances. For example, if you're seeing someone in the emergency department who hurt their hand, it's just a checkup. But otherwise, it might be a long time if you're planning surgery, for example. Let's just get this started. So, imagine that I just opened the patient's medical record and I'm just reading it, and I'm expressing my thoughts while I'm reading it. And I can see, let me get my cup of coffee. I can see that the patient has had a laparoscopic cholecystectomy in 2016. And from the surgical note, I see they had a bit of a difficult time. There was some bleeding and it took a lot of time, and they had to call in other surgeons, but they managed to pull it off laparoscopically. But the next day, the patient had pain, and there was a CT scan that showed fluid. They made the ultrasound guided drainage and found that it was bile leakage. So they placed, I can see here, yeah, they placed the drain, and they also put a stent in the common bile duct with an ERCP procedure. But then, well, the patient is an unfortunate one. The patient developed post-ERCP pancreatitis and actually spent a few days in the intensive care unit. But afterwards, it went well. So that was an example of me making some kind of brain dump while reading the medical record. This sort of preloads the model as preparation for the consultation, and now we can go and fetch the patient, and we resume it like this. And I could say, so what brought you here? I can see that you have referred to me because of abdominal pain. Yes, doctor, I've started having these attacks of pain. It's quite terrible here in the top of my stomach, and they come on quite suddenly, and they last several hours. And at one point, my skin turned yellow for several days afterwards. The pain actually reminds me quite a lot of the time I had gallstones before my gallbladder was removed. Okay. So, do you have any other symptoms when this happens? Yes, I have nausea and vomiting. Okay. So that was just to give you an example. Sometimes a consultation is very neat, and other times it's very messy. And we all know that patients can be in various states of crisis, and have pain and stuff like that. All sorts of things that contribute to not being particularly good always at explaining things. But we get these crisp and clean notes, regardless of the way the conversation flows. And we designed FactsR and the new assistant to give these easy to read, easy to understand notes, to create a psychological environment that's conducive to proper thinking. And of course, in easy cases, we would probably not spend too much time here. We'd just click generate and generate the final note. But in more complex cases, we would probably spend some time here. Let's add some more. We can also, after the patient has left or while the patient is getting dressed or whatever, we can keep adding things. For example, the plan. So the blood tests are normal, including bilirubin and liver enzymes. And I think we should do an MRCP to check for a stone in the common bile duct, which sounds like a possibility here. We can add that. Yeah. And we all know that AI makes mistakes occasionally or inaccuracies, and those things can be difficult to spot if we go with the classic scribe approach with a conversation, click a button, and we get a final note. It can be difficult to spot these things, but this way it's easy to spot it, and we can edit it. And if there's something we don't want in there, for example, we'll say that this might be too much detail. We don't care, and we don't care about this either. And we want to edit this like that. Then we can do that. We want to make it very explicit what's going on. Now we can generate a note. We can do many different things. Basic SOAP notes are very comprehensive assessments, and we can also make referrals to cardiologist or podiatrist or whatever, and it's all based on what's in these facts. And we can go back and make a change, and now we're alerted that this needs an update, and we can update it. So in this way, we can generate multiple documents, and we create an environment that invites critical clinical thinking. And this is also the right place, a good place for us to bring other AI tools to bear on it, for example, with the chat function and other mechanisms. So that's the way we made FactsR.